It's Wellness Wednesday, and we are at Eternal Wellness, and we are with Dr. Joel Strell, and today we're going to talk about the Emsella chair. So women, if you have pelvic floor issues, you're going to want to sit where I'm sitting right now. So walk us through, what is this all about?
Yeah, so the Emsella chair, again, is from BTL. It's that physiotherapy company or physical therapy company, and that uses the same technology, that high fem technology, and it's targeted at the pelvic floor muscles. So it's fully clothed, 28-minute session where you just come in, you sit in the chair, and really what we're trying to target here is stress incontinence, urinary incontinence, or that mixed incontinence that people can have. So if you're someone who maybe has had a couple of children, you jump on a trampoline, jumping jacks, jump rope, have a little bit of leakage of urine, this helps strengthen that pelvic floor and take care of those issues.
Okay.
It can also be used for men, specifically men who've had a prostate surgery or some sexual dysfunction. This is a great tool for that as well. Improves blood flow to the area, strengthens those pelvic floor muscles. Again, fully clothed, 28-minute session, usually about 4 to 6 treatments depending on where you fall.
Okay, and so 28 minutes, I'm fully clothed.
Correct.
Do I come in for a consultation first? Like, how does this kind of...
Yeah, absolutely. So we recommend coming into Eternal Wellness, have your consultation.
Okay.
We work with a physician, a doctor here in town of physical therapy who specializes in the pelvic floor.
Okay.
So after your consultation, if you're a good fit, we send you over to see her, Dr. Leah, and she does a baseline assessment, make sure there's no other issues happening, and kind of see where you are to start. Then you come in for your 4 to 6 sessions, and then you go see Dr. Leah again at the end of your treatment to kind of see the progress that you've made. Now, just like any other muscle, it does take some maintenance. So typically every 3 to 6 months, we recommend you come back in, spend another 28 minutes on the chair. Also doing those Kegel exercises in between as well to help keep that strength. Yeah.
Okay. And what does it feel like?
So it does feel a little strange.
Okay.
It feels kind of like a tapping sensation in that area that we call the perineum. But it's painless and just a little bit of an odd sensation, contracting those muscles without really voluntarily contracting those muscles.
Okay.
Yeah. So to position, we want you kind of in an athletic stance. You're sitting actually pretty much perfect. I'm going to lift up the chair just a little bit so we have your feet flat on the floor.
Okay.
Legs just slightly open, just a little bit more. Perfect. That looks really good. You're sitting up nice and tall. You feel like you're in the right spot? Okay. Once she's targeted, we can get you into a proper session here. It's definitely a different feeling. And again, it's going to give you about 2 minutes of warm-up. Let those muscles warm up a little bit, and then it's going to take you through those, so over 11,000, equivalent of 11,000 Kegels in 28 minutes.
Yeah, it's an interesting, like, pulsating feeling.
Correct.
Right.
Yeah. Okay.
So
That doesn't hurt at all.
Yeah, shouldn't feel any pain with this. It's a little bit of an odd sensation, like you said, a little bit of a tapping feeling or a pulsing feeling, but there shouldn't be any pain involved.
There's no pain.
No. So we'll take you up a little bit more. You're at 10%. We can take you up to 20 or 25. And depending on where you are, some people who are a little bit more elderly, we don't want to work them out too hard because then that can actually make their symptoms worse for a day or two because those muscles become really fatigued.
Yeah.
It's a pretty intense workout for those pelvic floor muscles.
It feels you described it well. It's an involuntary, just like lift kind of feel.
Yeah. And so we know there's about 200 women, specifically 200 million women who are suffering from pelvic floor dysfunction, stress incontinence, urge incontinence, or mixed incontinence. And unfortunately, it's one of those things that's a little bit taboo, and a lot of women don't talk about it, but it does affect a significant amount of women. Like we talked about, either they've had a couple of children, vaginal births, they're jumping on a trampoline, or doing box jumps at the gym, trying to do jump rope, and they're leaking urine, and they think it's just something they have to deal with. When there are some solutions out there.
And this one, I'm just sitting here.
Just sitting here, yeah, exactly. It's 28 minutes, you're fully clothed, there's no pain,
does not hurt at all. It doesn't hurt at all.
So it's a great solution, whereas there are some other treatments out there, but significantly more invasive, which a lot of women would prefer to just stay clothed and come in, have a seat on the chair, read a magazine.
Yeah, 28 minutes.
28 minutes,
yeah,
exactly. We typically recommend about 1 to 2 sessions per week.
Okay.
Again, 4 to 6 sessions, depending on where you are. If we have a lot of work to do, that pelvic floor is really weak, you might need more closer to 6 sessions.
Yeah.
Whereas somebody who is maybe a little younger, or has a little bit stronger pelvic floor, we might be able to get away with 4 sessions. But we can determine that at your consultation and in conjunction with Dr. Leah.
Okay. Well, if you're interested in this or more information about pelvic floor and everything else that Eternal Wellness has to offer, head over to 9and10news.com.